Hello and welcome to Immune Recovery. I'm Dr. Christine Bowen,
And I'm M. Bowen.
and we are going to be talking to you today about arthritis. So, May is National Arthritis Awareness Month, and so that's the topic that we have chosen to speak on. And we both have arthritis of some degree, is my understanding. Do you not have arthritis?
I have arthritis.
Oh, okay. So, how do people know if they do or don't have arthritis when they have joint pain, right? So, a
Right.
lot of people have joint pain. So, why are you having joint pain? So, that's the important piece. So, recently you found out you didn't have arthritis.
Correct. Yeah, I've had some chronic discomfort in one of my hips. So I had some x-rays taken, and whatever is going on in there is a soft tissue issue. It's not about the bone. It's not about the physical joint. So that helped us kind of clear up, like, okay, what is our approach going to be? What is the long-term prognosis? But I was really glad to kind of rule it out.
Yeah.
So, like, there's still kind of a question mark
Yeah.
for me about, like, what's happening,
Yeah.
but I know that's not what's happening currently.
And then things like your hands. Did they take x-rays of your hands, x-rays of your feet as well?
No, we haven't x-rayed my hands. We've x-rayed one of my feet just because I've had some chronic discomfort stuff going on in my right foot. And again, x-rays are clear. So we know that there's something going on soft tissue wise, something going on with a history of spraining my ankles, that kind of stuff. Probably did some ligament damage. So then there's next steps, probably like an MRI to figure out what's going on in those spaces.
Mm-hmm.
We know that it's not happening on that, like, skeletal level.
That's great. And so when you get an x-ray, it's about bones. So as Em was, basically leading us to, like, soft tissue, you would need to, so soft tissue would be ligaments, cartilage, what else? All the connective tissue.
Tendons, muscles.
Yeah, exactly. All the soft tissue, we would be able to see changes more likely in an MRI versus an x-ray. So if somebody has joint pain, then it definitely is important to ask your doctor, to have some workup. So one type would be imaging, something like x-rays or MRIs. Another piece would be blood tests. And so there are blood tests for things like rheumatoid arthritis, which is an autoimmune condition. And so for rheumatoid arthritis, typically the marker rheumatoid factor, that's what it's called, might come back positive, but not always. So sometimes something like an x-ray may show something that the blood tests are not showing. For rheumatoid arthritis, oftentimes we think of rheumatoid arthritis as being like both sides, but not always. Let's take 3 steps back, right? And look at the overarching. Do you have those statistics from the Arthritis Foundation handy?
Let me pull these up. So the Arthritis Foundation tells us that arthritis is the #1 cause of disability in the United States.
That's significant.
Right. And they also say that there are more than 100 types of arthritis and related conditions. So we're going to talk probably about at least 3 types that are the most common, but we want folks to know, like, there's related conditions. There's lots of different types of issues that people have, and they affect more than nearly 6 million adults and hundreds of thousands of children just in the United States. So there's resources, and we're wanting to help you with a little bit of education today.
Yeah. And I think your microphone blipped out just a second. 60 million adults and hundreds of thousands of children was the statistic. And so we'll see if the microphone stays on task here.
Hopefully it continues working smoothly.
All right. And so the three main types of arthritis that we're going to talk about today, I don't know about you, but like that statistic of like hundreds of types of arthritis was kind of shocking to me. And I'm a doctor. I'm like, I should know these things. But then I'm like, oh, it's about what they're classifying under that umbrella. And that, yes, there are a lot of different ways that the body can be inflamed and you have inflammation in the joints. But then, which one of those are true arthritis versus something like an injury, right? Okay, so when we look at next up, so the three types would be rheumatoid arthritis, osteoarthritis, and psoriatic arthritis. And so rheumatoid arthritis we think of as being traditionally autoimmune related. Many times it will come on suddenly or have extreme pain, inflammation of the joint, tenderness. Somebody may not be able to walk because of the discomfort in their legs, their hands, they may not be able to grip things. I see a lot of people with pain in their elbows as well. And so then that can also make things quite difficult. So when we think of arthritis that's rheumatoid, that's more likely to create more of that joint damage that is associated with rheumatoid or associated with autoimmune conditions. And where the immune system attack is on the synovium of the joint. So I feel like you're like the anatomy expert. So the synovium of the joint, can you tell me a little bit more about that, or is that not in your musculoskeletal bandwidth? Right?
Well, I mean, it's always about like, do I have the exact wording? So
we don't want science
having a capsule with synovial fluid.
Yes.
Right? So
there's like liquid in
synovium, the liquid, or is it the surfaces?
That's a good question. I feel like it's the surfaces and not necessarily the liquid. But then basically when we see what's attacked, that they say it is the synovium. So synovial fluid would be the fluid. The synovium would be the capsule. Okay. We sorted that out. So basically then the capsule, so the capsule is like around that joint. And so then all of that capsule as well as the joint itself can all get inflamed. It can get damaged. People can lose mobility because of this. You can have a disfigurement of your joints. So sometimes you'll see people with significant changes in like how they're, so it's like they call it
knuckles and maybe an inability to fully flex and extend the fingers.
Mm-hmm. So Em, being a massage therapist as well, has a lot of experience with helping people who are in chronic pain. So you're like, oh, these are specific things that people are able or not able to do or having difficulty with doing because of the pain and inflammation. And then it can wear away at the joint to where somebody may need a joint replacement. Sometimes that can be fraught with danger because, how does your system heal from that? And then you have to try to get some function back. So if a joint is completely destroyed.
There's so much independence, especially in our hands. You've named some other joints this shows up, but especially in our hands, dressing ourselves, feeding ourselves, these kinds of things become big focuses for folks who have any of these arthritises in their hands, right? Mm-hmm. And so
they don't have hand replacement surgeries. This is something where it's like, I have seen where they'll fuse people's fingers together. So oftentimes we think of the joints associated with rheumatoid arthritis. So this one here, I don't know if you can see it, has a little lump on it. That's normally more like osteoarthritis at that tip of my finger. There we go. At the tip of my finger there, that's the mousing finger, right?
Right.
And our dad has a big old lump on that finger too. I've noticed. I'm like, oh, and then his finger's like a little bit like this. I'm like, he's pointing at things and it's like this, right?
Right.
So we definitely think of those are changes that arthritis will create in our bodies. Typically, this joint is associated with osteo, but not always. This joint can also be associated with psoriatic arthritis, which we'll talk about in a little bit. But traditionally, when we're looking at rheumatoid arthritis, it would be these knuckles. So these...
those middle ones.
Middle knuckles closer to the body of the hand, those ones will get really inflamed. So you'll see people come in with a big
can see
old
like
red
redness
inflamed.
and hot. You can just see it from even a distance. You're like, that looks really painful.
That looks really painful. And so that's just a single joint. Then that's a situation where it might be a single joint versus somebody with rheumatoid arthritis might actually have it in both knees. Sometimes one knee is worse than the other, or both elbows. One might be worse than the other, but typically it will attack on both sides. And so that's it's not necessarily like nobody is textbook in how their conditions
not diagnostically perfect.
Yeah.
But if it's happening on both sides, we might say it's less likely to be osteoarthritis and more likely to be rheumatoid. But what about like psoriatic? Is there a pattern to the way psoriatic arthritis shows up? So I'll take one step back.
Yeah.
Psoriatic arthritis tends to show up in people who've already displayed psoriasis.
Yes. And so psoriatic arthritis normally is connected with folks who have psoriasis, which is that skin condition that you get plaques built up. Yeah, oftentimes the elbows, the knees, sometimes the inverse psoriasis will be like under skin folds or other places, right? So with psoriasis, so that's a tip off. If somebody has arthritis type symptoms and also has psoriasis, it's pretty likely that somebody will have psoriatic arthritis, but you still would do the same workup that you would do for rheumatoid arthritis.
Okay.
So it's still like the workup is not any different, but then I'm not sure. Sometimes they'll call things like, spinal inflammatory arthritis. Yeah, it's good. We'll look at some of the statistics when we get to psoriatic arthritis, but I feel like the rheumatoid is autoimmune, and then osteoarthritis is considered non-autoimmune. And that osteoarthritis, basically, they used to just consider it something that everybody would get just from aging. And that they would call it wear and tear on your joints or overuse injuries or things like that. Those things still can happen, but it's not all osteoarthritis. And osteoarthritis is not just from aging or from overuse. It can also happen from other inflammatory processes in the body. And so I think that there's still not a lot of clarity in the traditional medical system about what is causing osteoarthritis and why it's different from rheumatoid. And you can still see high inflammatory markers with something like osteo. But then they're like, oh, it's not. And then high inflammation, but they're like, it's not autoimmune. So that's basically like osteo is
attacking itself in the way that in autoimmunity, we recognize that some part of our body is attacking our tissues. Mm-hmm. Whereas with osteoarthritis, we recognize that there's inflammation, but we're not assuming it's a feature of the immune system.
Exactly. So inflammation, then when we see some of the ways that we'll approach this through like naturopathic medicine. So in naturopathic medicine, we know that there's an impact of blood sugar on osteoarthritis. And so somebody who has slightly higher blood sugar, it might be in the pre-diabetic or diabetic range, will have more inflammation in their joints associated with having higher blood sugar. So is it just that it's inflammatory? That, having higher blood sugar is inflammatory to the system, but it seems to have a really specific role for osteoarthritis or in creating or inflaming osteoarthritis. So an example is, a patient who has uncontrolled blood sugar may experience more joint pain versus when their blood sugar is controlled, then they may have much less joint pain.
Because we know that sugar is inflammatory, right? That's a thing that we know and have incorporated into our programs, that awareness. So to me, it makes sense when you're saying that. And I remember when I was in massage school, we had an instructor that was a physician who told us that a lot of people get relief from osteoarthritis by avoiding foods in the nightshade family, which I know is also some wisdom that we have in some of our programs around when the body is vulnerable or already in inflammation. Unfortunately, some of the components of those foods can cause further inflammation.
Yeah. So nightshades are a food group that includes, just as a reminder, in case you haven't seen some of our other videos, a food group that consists of things like tomatoes, peppers, white potatoes, even like goji berries are in the nightshade family. What else am I missing? Eggplant.
Any kind of eggplant. I think is the other big obvious one, yeah, any peppers or chilies.
Mm-hmm.
So a lot of people's favorite spicy things, like we just named most of the things that are in salsa, or a lot of Italian food. Um, so just being thoughtful about, sometimes people can remove those from their diet even briefly and see if,
Mm-hmm.
is the pain decreased, or if I'm going to watch my sugar, or I'm going to use more natural sugars rather than white sugar, or
Measures to control my blood sugar better, whatever it is. If your blood sugar is out of control and not being well controlled, how are your providers helping you? If those providers are not helping you, then have you considered seeing a naturopathic doctor or a functional medicine specialist who might be able to better help you with nutritional strategies or other pieces for controlling blood sugar better? So osteoarthritis is not just wear and tear, it's inflammation. There's the verdict is still out on underlying causes completely, but they do think that things like aging play a role. And yes, wear and tear can play a role, but then there are these inflammatory changes that seem to have some of their own, some of their own contribution to the overall condition. So then when we look at rheumatoid, so it's autoimmune, it typically can be more severe, but there are times when you're looking at somebody with osteoarthritis, rheumatoid arthritis, and psoriatic arthritis, and they might look identical as far as like how that person is feeling, the joint pain, the lack of mobility. And, typically with rheumatoid, it might be more hot, red, and swollen.
Yeah.
Versus something like osteo, it might not be. The pain might feel like it's hot, red, and swollen, but it might not look hot and swollen.
Right. I think that's important to say that the person who's experiencing any of these experiencing pain, regardless of what the onlooker is seeing.
Mm-hmm.
We shouldn't judge when people say like I'm at a 8 out of 10 pain, like that's true.
Mm-hmm.
No matter what it looks like visually. Is there a difference between like how active we should be with the
Mm-hmm.
osteo versus rheumatoid?
Yeah, so if you have osteoarthritis as a diagnosis and you are able to stay active, then that's really good for increasing range of motion. Some of my patients who are keeping range of motion or even increasing it, but some of my patients who have had osteoarthritis found that daily, regular routines, things like, stationary bike or, even if it was like, shoulder or something, like trying to keep range of motion, using TheraBands, whatever it is. So there are always, movement routines that can help people with just about any mobility limitations or restrictions. So just being able to know that you can still move even if, walking is not going to be your movement of choice. So Sit and Be Fit or some of these other, there's some great mobility mindful programs that are out there on YouTube free. So just looking for ways that you can move that don't give you excruciating pain, that will keep basically those joints a little bit more lubricated. And then oftentimes if people take a break from exercising, or sorry, from moving, therapeutic movement, I don't like the E word, you know me, right? Therapeutic movement, if they take too much of a break, sometimes they'll notice that they stiffen back up. And so it's that like maintaining range of motion, keeping joints. Mm-hmm.
That makes sense. Yeah. Well, and let's choose to drop a link to the Sit and Be Fit
Mm-hmm.
so that people have access to that, because it's really good for you to be able to stay active in a way that promotes your continued best health.
Yes,
Right?
and it does not have to be whatever hyped out program is out there that you might
Have the
injure
word
yourself
power
doing.
in it or anything like that.
Just like even 20 minutes of something that feels good for your body. And so then you were saying like motion or therapeutic motion and how it might, be different for one person versus another depending on the types of arthritis. So if somebody has rheumatoid arthritis and they're in a flare, it is best to rest those joints. So resting them, icing them when something is like swollen and hot, like icing it can definitely help to at least calm that down. And then when we look at how we approach the different conditions, so osteoarthritis, we might be controlling blood sugar, keeping people mobile, making sure that they have a true diagnosis of osteoarthritis and not rheumatoid. And if you wanted to make the nutritional change of things like eliminating refined sugars or nightshades, or just seeing if any of those pieces make a difference for you.
Right. Gluten for some folks too. Yeah.
And then before you remove gluten from your diet, because it's also celiac awareness month, before you remove gluten from your diet, make sure that your provider tests you for celiac disease and blood work at least. Okay, that was the end of that PS. But yes, but sometimes people will find that gluten.
No, it's important. It's important because this is a reason that you and I, who have eliminated gluten, can't get a clear diagnosis of whether or not we're celiac, is because it helps if you've been have exposed in like a normal diet kind of way to it to be able to determine the body's reaction. Yeah.
Yeah, it's very hard to diagnose celiac disease if you've been off of gluten for a long time. So I'm just speaking to that. But yes, gluten can definitely be inflammatory. I know that there have been times where you're like, you can tell that something was cross-contaminated with gluten because your hip told you. So that was
part of that I feel like I have broken glass in my joints. While we started this out saying I have not been diagnosed with any kind of arthritis, I have felt like for 2 or 3 days in a row a lot of pain in my hips, knees, and ankles when I have been exposed to gluten. So is another thing as people are working through the different understanding of the types and getting good testing and diagnosis, it could be a food sensitivity showing up as inflammation in your joints.
Yeah. So just paying attention to like what your triggers are, knowing more about so that when you're going to your provider and you're saying, I have joint pain, you can say, I have joint pain that seems to be worse or better with XYZ. This joint pain is constant. It's throbbing. It doesn't matter what I do. This joint pain is intermittent. It comes and goes. It's worse in cold months. It's better in warm months. That might
more
be
in the morning or at the end of the day. Things are really helpful for being like, maybe, if you feel it in the morning, it could be about your sleep pattern. It could be about the quality of your bed, right? There's so much information as we're trying to understand what's going on.
Yeah, we love those details. And so being able to kind of track what your patterns are doing. There are lots of apps for tracking symptoms, but you can just use a note and just be like, when it's bad, like, what are you noticing? Right. Instead of like tracking every single day, it's fine, it's fine, it's fine. Like maybe you only take notes when it's feeling particularly bad. You give yourself your own pain scale. Typical pain scales are like 0 to 10, and typically like 10 out of 10 is the worst. 0 out of 10 would be like nothing. And so it's definitely something that you can still have your own way of interpreting what your symptoms are. But if you know some of those pain scales, then you're able to communicate it to your doctor in a way that they might have been educated on.
Absolutely.
So osteoarthritis can definitely result in need for joint replacements as well, because it still can cause enough damage to those joints that those joints have to be replaced for that person's comfort and mobility, as the case may be. So rheumatoid arthritis, autoimmune, may still cause joint damage that results in joint replacement, may not have as easy of a recovery sometimes because of the autoimmune piece. It can be a little bit more complicated.
But, and it's still active in there, even in a new joint.
Yes, that you still have rheumatoid arthritis in your body. Even if this new joint doesn't have rheumatoid arthritis, the areas around it may still be impacted. And so that's something that I've definitely seen, pros and cons of certain types of surgeries, of certain types of autoimmune conditions. So psoriatic arthritis is also considered an autoimmune disease. And so as we talked about, it's connected to having psoriasis. And then with psoriatic arthritis, it looks like the places that psoriatic arthritis is attacking is the skin and the joints. So we definitely No, the skin is involved because of psoriasis. And then when we look at the patients with psoriasis, about 1/3 of the patients with psoriasis go on to develop psoriatic arthritis. That's a pretty high rate. There are a lot of people with psoriasis, so that means that there are a lot of people with psoriatic arthritis as well. So roughly 125 million individuals worldwide have psoriatic arthritis, and that it can show up at any age, including in childhood. Versus like osteoarthritis, normally we have a few years under our belt before we start seeing some arthritic changes. But then something like psoriatic or rheumatoid, they have onset in childhood as a possibility. So that's something that we should consider. There's always that question with children too, and I'm not a pediatrician or a rheumatologist, but when we see kids that are complaining of joint pain, is it growing pains? Is it normal?
Right.
Or is it abnormal? And so if it's hot, red, and swollen, that is not growing pains, right? So definitely, make sure that you're not just, blaming something on something benign if it could be something a little bit more concerning that needs sooner workup. And so that's one little note about that. And then with psoriatic arthritis, then you look at the attack is in the junctions between the bone and the tendon at the vicinity of the joint, or what they call an enthesis. So do you know what an enthesis is?
Different than the synovium.
Yeah.
So you said it's the connection between the tendon,
the bone and the tendon at the vicinity of the joint. So we're looking at the joint and then the tendon. What's the tendon again, Em?
The tendon is the end of the muscle, kind of. So our muscles are wrapped in connective tissue or fascia, each individual muscle fiber, and then groups of them, and then the whole thing. And so it's like kind of like saran wrap.
Mm-hmm.
So all those little wrappers on those different scales, all of that comes out the end. It has less blood flow than the muscle, right? It's more fibrous. Folks who are carnivores have probably seen this in things they've eaten, where it's like this is gristly, it's tougher, it's fibrous. So that's going to be tendon.
And like the shiny part on like meat, that's like the connective tissue, or like the fat.
Exactly. Okay. Exactly.
Okay.
So you'll see things that are kind of in different separate pockets, right?
Mm-hmm.
So it extends out from the muscles, and with that tendon, that's what connects the muscles to the bones. Mm-hmm. And so it sounds like in those connections, in that connective tissue, we're having this flare. Mm-hmm. Instead of in that joint capsule. It's pretty similar space, mm-hmm. But slightly different mechanically.
I was just thinking, like, what are the tendons that people would recognize, right? Like ACL. What's an ACL?
That is a ligament.
Mm. Oh, you're right. Tendons, you might know about your tendons with tendonitis instead. So like
Achilles tendon.
Achilles tendon, there's the one. I was like, which ones? See, this is why we have M for all of the anatomy. I'm like, bring it in. Been too long. Right. So Achilles tendon is a really big tendon there on the back of our. So that's a place that you could actually feel the pain then, right? Is like where that tendon is anchoring into the heel. So, okay, so that helps us to kind of think of the spot. So if people are having pain where those tendons are meeting that joint.
Right. This is one thing with our hands is we have some muscle in our hands, but mostly the muscle that controls our hands. Here, I'm mm-hmm. trying to put it in front of the camera. We have a reversing camera thing. So some of the muscles that go into the hands, it's really the muscles are in your forearm.
Can you see it wiggle?
Right.
Those muscles in my forearm.
This is the muscle. And then the tendons extend into the fingers. Mm-hmm. And so we have like kind of So if I had psoriatic arthritis in my hands, mm-hmm. that would be because it's mostly tendon connecting to bones with just a little bit of soft muscle here in the palm. where all
Mm.
is coming. And same with the back of the hand. These muscles are here, and then the tendons extend into the back of the fingers.
That
So I
makes
could,
sense then for why the farther joints are affected with psoriatic arthritis, is because that's where a lot of the tendons are anchoring.
absolutely.
Aha, we solved all of the issues there, right? Didn't we?
Right?
But-
We discovered everything.
So just like osteoarthritis and rheumatoid arthritis, if psoriatic arthritis is left untreated, it can destroy, damage, or weaken bone. But then also with psoriatic arthritis, it can cause vision problems, gastrointestinal or digestive problems, shortness of breath, damage to blood vessels, or even heart muscles. So just knowing that it's like soft tissue and skin, which is also soft tissue, that it could impact some of these other areas of soft tissue as well. And then rheumatoid arthritis, there's some theories about what causes it. So autoimmunity we've talked about this if you've seen our webinars and things, but autoimmunity can be caused by many different things. Oftentimes it's a few factors that cause that particular person to have autoimmune disease come on or start manifesting. You might have a predisposition to something like autoimmune disease, such as rheumatoid arthritis, or even psoriasis or psoriatic arthritis with your family or genetic link. But it's not the whole thing. Oftentimes, genetic link is one piece, may or may not, predispose you to getting an autoimmune disease. But then also environmental factors, like if there are exposures to toxins, wearing away the health of the microbiome with things like repeated exposures to antibiotics. Do take antibiotics if they're necessary, but otherwise, maybe don't take antibiotics with everything that you think might actually be a virus. That's not helpful, and it can really hurt your microbiome. So I think people are kind of pulling back a little bit on overprescription of antibiotics. So the microbiome health, your gut has 70% of your immune system in it. So gut health is huge. Getting things like infections. So Proteus mirabilis is just one of many organisms that they're like, if you have this infection and it's a digestive tract infection, you can have arthritis, rheumatoid arthritis, flip on like a light switch. And this is a process called molecular mimicry. And so they think that the organism itself creates something that causes the system to start attacking tissues that may mimic structures associated with the organism. That there's something that's like the immune system is confused and it starts attacking itself instead of attacking the invading organism. Em, are you muted? Sorry. I'm like, I want to hear what you have to say.
Dog was barking recently.
Oh, there we go.
Yeah. Yes. Thank you. Yeah, I could see that the body's trying to attack a virus, but it's gone a little sideways and it's now attacking the body's own tissue. So that makes sense. Are there, you talked about like continuing moving for osteoarthritis. We talked about blood sugar levels. With rheumatoid, we talked about, kind of icing and resting joints. Similar with psoriatic.
So with psoriatic, yeah, I would think probably more similar to rheumatoid, that if you have some really inflamed joints, that you should not try to push through it. When you have significant pain like that, plus that level of really high inflammation, like don't push through that, rest that joint, try not to injure it more when it's in such a state of anger. And then a lot of the treatments for psoriatic arthritis are the same sort of treatments that we would use for helping people with psoriasis. And so that includes like our immune recovery program. The 3-month program walks people through a step-by-step elimination of some of the foods or food groups that may be problematic for people with autoimmune conditions. So this is the same thing. So if you have psoriasis, you have psoriatic arthritis, you have rheumatoid arthritis, maybe even if you have osteoarthritis, because we know that some people in our program didn't have a diagnosis of autoimmunity, but they had a lot of inflammation, and that their inflammation still responded to the program.
Yeah, so we're targeting that. And there are other meds, and we hope that they continue to get better with fewer side effects. Biologics and systemic kind of stuff. And exercise caution. For me, I watched Someone close to me, one of my in-laws who had rheumatoid arthritis, got a medication that was still considered experimental. But she had so much pain that she really wanted relief.
People are desperate. Yeah.
Yeah, and I want to honor that. I don't want to, anybody who's like, I don't want to change these lifestyle things.
Oh, yeah, a lot of people don't want to take meds too, and it's like, but yeah, it's just like sometimes it's important. Yeah.
Right. But because of that medication, she had to be on an oxygen tank for the rest of her life.
Oh my God.
It really changed her mobility, her ability to leave her house, her ability to socialize with friends and family. And so, I just want to be thoughtful about that, because that, that's just one anecdote, but that's why we're definitely going with the Hippocratic Oath of first do no harm.
Mm-hmm.
If you need to bring in the big guns, get the big guns.
Yeah.
We don't begrudge anybody that kind of support.
This is not a judgment. Yeah. It's more like yes and, right? It's like, right. If you're taking medication.
There's the fear of really harsh side effects like this potentially with some of the treatments. And so we want to give people something that has a lot of side benefits rather than side effects as they approach things. And we believe in consumer empowerment. Like, you get to decide, like, how do you want to approach this? What does your wise inner healer say is where you want to start, and what kind of questions you want to ask, what kind of interventions you want to jump into. And we'll just give you the best information we have currently.
Exactly. Which tools do you want in your toolbox, right? Your unique tool.
Yeah, 100%.
So with that all in mind, then just knowing that things like lifestyle changes, nutritional changes, movement changes, sleep improvement, stress reduction, like all of those pieces can definitely be tools in your toolbox when you're managing conditions such as the big umbrella term of arthritis. And then remembering that nutritional changes and some of these other lifestyle pieces are not contraindicated, or they don't conflict with medications. And so if you're already on medications, but your pain is just not being managed, you're still having pain, breakthrough pain or inflammation, that you're doing all of the things that your primary care or your rheumatologist want you to do, but it's just not enough, then that's when you can look at these being additions to the tools in your toolbox, instead of like, it doesn't have to be an either or. You can pull all of these tools in. And then the other thing that I want you to know about nutritional change for conditions like arthritis is that you may not need to make all of those changes long term. And so there's typically an intention around, having this be a 3-month program, is that we want you to be able to bring foods back in, reintroduce them at the end of the program to find out which ones are more triggering for you versus for somebody else. So it's not about following something that's a more limiting plan long term, but rather helping you to get a clean baseline, kind of reset the immune system function, and then bring foods back in. And then if your rheumatoid arthritis associated joint swells up when you reintroduce nightshades, then you'll have some answers that help you to make clear choices around food going forward. Then you can really be like, I'm just going to have that pasta sauce and I know exactly what it's going to do,
Right. Well, and I think of it as like, we're inviting people to take their behavior, their habits, and their guts to like a health spa for 3 months. You're going to do the detox.
It's an accessible health spa.
Personal autoimmune treatment, right? And you don't go to live there, but you do really thoughtful practices around healing, around quelling inflammation, calming it down. We had one person who was in our program who said she experienced a pain-free day for the first time in 20 years.
Oh,
right.
That's so
her pain was related to a car accident, but joint pain and joint inflammation was showing up there. And so I hope people will consider it. And regardless, we want to be here as educators. We
Yes.
want to be here to share information with you so that you feel empowered around your health journey.
Yeah, absolutely. This is great. Thank you so much, Em. I feel like I could chat with you for hours, and I hope that others find it as fascinating and interesting and informative as we do. So, thank you so much for joining us today, and we will see you soon.
Please subscribe to our channel and hit the notification bell to be notified when we post new content.
Make sure to follow us on Facebook and other social media.